Hello, welcome back to Pharma Training Solutions. I hope you have subscribed our channel. In case you haven't, you can click on the subscribe button. Today I'll be discussing drugs which are used in ischemic heart disease or the myocardial syndromes. Now, this is a group of clinical syndromes characterized by myocardial ischemia or an imbalance between myocardial blood supply and myocardial oxygen demand, and this is mainly due to the coronary artery narrowing and abnormal vascular tone. Now, when we reach the types of angina, we shall have the variant angina, which is talking about vasospasm within the coronary artery leading to angina, and of course as a result of endothelial dysfunction and atherosclerosis. Now, of course, we know that atherosclerosis, this is a plaque or thrombi formation. Now, in this instance, it is within the coronary arteries. We talked about atherosclerosis in this other presentation, or the thrombi. Now, of course, the acute coronary syndrome, it is what we call heart attack. It's what as unstable angina and the myocardial infarction. Now, remember, this is a short presentation, but in our preceding discussions, maybe when we reach therapeutics, we shall discuss the pathophysiology. Now, let's look at angina pectoris. Of course, this is a primary symptom of ischemic heart disease. This is, of course, as I said earlier, due to an imbalance between my oxygen supply and demand, or an increase in my oxygen demand, or coronary atherosclerosis, or due to the thrombi or plaques within the coronary arteries, or the arteries which supply the heart itself. Now, typical angina is experienced with a heavy pressing substernal discomfort. I hope we know that, often radiating to the left shoulder. Again, there are other symptoms and the pathophysiology which we shall explain later on. Now, which are those types of angina? We have stable angina, because one is due to emotional stress or heavy exercise. This is also referred to as triggered angina. Unstable angina, this is mainly due to high cholesterol levels, which form the plaques or the atheromatous plaque, and when it ruptures, it can hinder blood supply to the heart, attracting more platelets. This one can even occur at rest. Now, we have variant or presmito overactive angina. This occurs mainly during rest and due to vasospasm within the coronary arteries. Now, which are those drugs which are used in angina? Of course, we have the organic nitrates. These are prodrugs and the source of nitric oxide, a potent vasodilator. And how does it do it? It causes reduction of systolic calcium ions, and then of course we know that this one will lead to relaxation. There won't be contraction within the smooth muscles, hence vasodilation. Examples, we have the short acting or the nitroglycerin, or what we call glyceryl trinitrate. This one is given sublingual PRN as needed. When the patients have heart attack, you just put it under the tongue and dilate the blood vessels, hence symptoms of angina will cease. Now, we have the long-acting one. We have isosobide dinitrate, isosobide 5-mononitrate, and of course inhaled nitric oxide gas sometimes can also be used. Now, we also have the calcium channel blockers. This one, of course, we know they block the L-type voltage gated calcium channels, hence leading to vasodilation and reducing in the heart workload. Examples which are those are used in angina, we have verapamil, diltiazem, and sometimes nifedipine could be used. The beta blockers, here we're interested in the beta 1 selective, because remember we're in the heart. Betenolol, bisoprolol, metoprolol. Now, of course, as we have described in the pathophysiology briefly above of angina, it can also be due to platelet aggregation. Now, we also have these drugs which inhibit platelet aggregation. I'm sure I've talked about them. The aspirin, which inhibits thromboxane formation via inhibiting the cyclooxygenase enzyme. Of course, you know that it is that thromboxane which causes attraction of other platelets. Also have clopidogrel. Clopidogrel, as I discussed in our blood coagulation disorders, it inhibits the ADP pathway. Clopidogrel, these ones are all given daily. Antilipidemics, these ones are common also. They inhibit cholesterol synthesis by inhibiting HMG-CoA reductase. Remember, we have high cholesterol levels in blood. They can easily cause atherosclerosis or plaque formation. Examples, we have rosuvastatin, atorvastatin, simvastatin. Now, you have realized that I've already talked about the pharmacokinetics, and there may be the side effects. Now, those are things that you can come up with. I know you have this information on your phones, on your app, the apps which you have. So now, since you have gotten something, you can go further and get those ones, because this is a short presentations, or you can contact us for more clarity. Now, I always remain Wilson from Pharma Training Solution. These are the other presentations which we have. Subscribe to our channel in case you haven't. Send us a comment on how we can improve. Like our videos, give us a thumbs up. Thank you very much.